Appendicitis, appendectomy, or the antibiotic-first strategy. Definition: acute appendicitis. Appendicitis is the most common reason for emergency abdominal surgery, with a lifetime incidence of 7 to 14%. As compared with open appendectomy, laparoscopic appendectomy is associated with a reduced risk of surgical site infection, a faster return to function, and a reduced risk of subsequent bowel obstruction. The diagnosis of appendicitis is supported by a history of abdominal pain that begins in the central abdomen and migrates to the right lower quadrant, tenderness to palpation or physical examination of that area, nausea or vomiting, mild leukocytosis, and low-grade fever. But these features are inconsistently present, and fewer than 50% of patients may have all these features. Application in medicine. Several small randomized trials comparing an antibiotic-first strategy with prompt appendectomy in patients with uncomplicated appendicitis showed no significant increase in complication with an antibiotic-first approach, but also showed a substantial rate of crossover to surgery in the first 48 hours or appendectomy in the ensuing year. Appendectomy is still recommended for most people with uncomplicated appendicitis, but patients should be informed about options, and an antibiotics-first strategy may be considered in those who have strong preference for avoiding an operation and who have contraindication to surgery. A video about microbial resistance to antibiotics.
Around a kindergarten class, a cluster of the bacteria infiltrate one of the students, taking up residence in Tommy's throat. They begin to multiply as he gets sicker. Tommy's mom takes him to the doctor. The doctor prescribes Tommy penicillin. The penicillin inhibits synthesis of the cell walls. When the cells start to divide, their walls are unable to reform, leaving them at the whim of osmosis and causing them to burst. In just a few days, Tommy starts feeling better. He doesn't like the medicine the doctor prescribed and stops taking it. The premature halt of the penicillin gives the few remaining bacteria time to regroup and grow stronger. The bacteria are resourceful, and they begin developing resistance by one of 4 ways. They could alter the target of the drug through mutation. The shape of the active site would then change and the drug becomes unable to bind with the cell. Or they could chemically degrade the penicillin before it is unable to attack. It is also possible to add a functional group to the penicillin, permanently changing its shape. The penicillin would not work as effectively since its new shape would prevent it from binding adequately. And a final strategy is pumping the penicillin back out through an efflux pump.
The pros. Appendicitis has historically been thought to result from luminal obstruction with a fecally distension, bacterial overgrowth, increasing intraluminal pressure, and progressive tissue compromise with gangrene and perforation. However, a more recent study measured the luminal pressure in patients with appendicitis has showed increased pressure in only a quarter of the patients. Similarly, in one study, fecalities were identified in only 18% of patients with appendicitis. Growing evidence also suggests that perforation is not necessarily the inevitable result of appendiceal obstruction. The cons: factor potentially relevant to the assessment of benefits and risk of appendectomy in the question of whether the appendix has an active psychological function or is simply a vestigial organ. The observation that the appendix appears to have evolved independently of the second across main species supports a possible functional role. Bacteria sequestered in the appendix may act as safe house, repopulating the gut with healthy bacteria after massive diarrheal disease. Video about scientists finally discovered the function of the human appendix.
It has long been regarded as a potentially troublesome, redundant organ, but American researchers say they have discovered the true function of the appendix. The researchers say it acts as a safe house for good bacteria, which can be used to effectively reboot the gut following a bout of dysentery or cholera. The conventional wisdom is that the small pouch protruding from the first part of the large intestine is redundant, and many people have their appendix removed and appear none the worse for it. Scientists from the Duke University Medical Center in North Carolina say following a severe bout of cholera or dysentery, which can purge the gut of bacteria essential for digestion, the reserve good bacteria emerge from the appendix to take up the role.
Surgical treatment. Urgent appendicectomy has been the mainstay of treatment for appendicitis since the late 118s, with a major advance made in the 1990s when the use of the laparoscopic approach was suggested instead of the more conventional approach involving incision in the right lower quadrant. Appendicectomy is performed laparoscopically in 60 to 80% of cases, with hospitalization lasting an average of 1 to 2 days and a rate of complication of 1 to 3%. The laparoscopic approach is contraindicated in patients from whom inflammation of the abdominal cavity with gas is contraindicated, most commonly because the cardiopulmonary condition. Most of the open procedures that are performed in the United States were initiated laparoscopically but were converted to the open approach because of technical limitation. Issued applet in Ecuador. Surgery is the treatment of choice in the first 48 hours into the box. If more than 48 hours, the inflammatory process has been extended and consolidated, so that a conservative approach should be adopted, hospitalizing person with bed rest and specific antibiotics. When the process is resolved, surgery with removal of the appendix must be scheduled between 6 weeks and 4 months later. Overall mortality is low if surgery is performed early, and discharge may be granted in a few days. Video about the laparoscopy appendicectomy. And the conclusion is the usual treatment recommendation for people with uncomplicated appendicitis is a prompt appendectomy. The laparoscopic approach is preferred to the open approach by most surgeons in the absence of contraindication to laparoscopy. However, it suggests that an antibiotic-free strategy is an alternative that warrants consideration, particularly in a patient who had prior surgical complication and has strong preference to avoid appendectomy. A video about laparoscopic appendectomy by advanced surgeon.
Appendectomy for acute appendicitis. The appendix is an organ at the base of the colon called the cecum with no discrete function. It is fed by a single artery
That
called the
video
appendiceal artery.
explained
Occasionally,
about
it can become
laparoscopic
obstructed,
appendectomy.
leading to acute appendicitis.
An acute appendectomy laparoscopic.